Hi everyone, this is a demonstration webinar for the AEGLE Platform for researchers and practitioners. I am Anna Paleolog, the project coordinator of AEGLE, and I am based in Greece. I would like to have an introductory presentation of the project, a very quick one, before we go into the demonstration of the platform. Anyone who has questions in regards whatever you see today, you can ask them through the Q&A functionality or through the chat. Attendees cannot speak in this webinar, unfortunately. So let's begin. AEGLE is a project funded by the European Commission, and here are the aims and the challenges that we're facing in the project. So the project aim is quite simple. We want to improve the performance of the healthcare system, and we want to do it through providing insights from medical data after these have been processed to doctors or people who are taking important decisions in the healthcare system. The challenge is of course similar to many other projects working in the field. The data amounts are enormous, so that's not so easy to handle. There is a need for intelligence, efficient analytical engines, and we want to achieve both of the above at a reasonable price, because improving performance without reducing the healthcare costs will not be as successful as expected from our politicians. In regards to the last one, we are running at the moment a questionnaire, so please provide your inputs. We want to find out what would be a reasonable price for a system or a platform such as AEGLE. Going further, so the solution that the project offers can be summarized in this very small but powerful sentence. It's a platform for big data, medical data, with libraries of standalone analytics. For whom? As I already mentioned before, it's not only for researchers, but it is also for healthcare planners and clinical practitioners, so actually doctors who are taking important decisions every day. The researchers, of course, can test their hypotheses, generate them. The practitioners, they are called to take fast decisions, especially in circumstances like the ones of the intensive care unit. And this system is supposed to help them. And the healthcare planners would like to have a better insight into the state of the population and take advantage of some predictive analytics. We have worked with 3 featured use cases in this project. These were the intensive care unit use case, the use case for diabetes, the non-malignant chronic diseases, and the chronic hematologic malignancies. So in particular, we have worked with chronic lymphocytic leukemia. We have already run a webinar 2 days ago for the ICU unit to demonstrate how researchers can use the platform. However, we are running another one to demonstrate how practitioners can use the platform on the 15th of March, where we invite you to watch what are the differences in the use. Today we will be demonstrating the platform for use for researchers who are working in the diabetes field, and later today also the case for leukemia. This is a prototype platform, so we will have another demonstration of our final product during a conference that we're organizing in May. During the 17th and 18th of May at the Erasmus University of Rotterdam in the Netherlands. You can find out more about this opportunity on our website, and we invite everyone who has a demonstrable result to show from either a project or a startup that they're running or any kind of other national initiative to submit an abstract and join us in Rotterdam in May. That is all from me for now. and I would like to hand over to John Chang, who is representing Croydon Health Services of the NHS Trust, to demonstrate to you the platform itself.
For that lovely introduction. My name is John Chang. I'm the Director of Research and Development at Croydon University Hospital, and we are part of the collaborators in this project. This is a very exciting project, and what I want to do now is show you our screen of working through the AEGLE platform itself, so that you can then see why we're so excited about going forwards. For people who are part of the project itself or subscribe to AEGLE platform, they'll be given a unique username or password to come in to log the system. Once you've got that, you can then enter and access the platform accordingly. This will be the effective home page that the user who's allocated admission rights to the platform can use. So type in their username, their password, and then log in. When the user logs in, they will see the parameters that have been defined already, and for us, we're dealing with diabetes. For the purposes of this presentation, blindness covers severe retinopathy with significant visual impairment. When you log in the screen, you will see that in the screen itself, it's got lots of functionality on the left-hand side, and there's some of the workflows that's already been run today. In terms of what these things are, this is the workflow for our workbench. What we're interested with data sets, and you can see in here, you can either create your own data sets or add new data sets, which researchers can or cannot do. These are previously defined data sets that we've got within our system. So if you look at one of these things, you'll see within them, there's a rough description of what the data is. In other words, what data contains for diabetic patients, when it was uploaded, who it's by, and whether the data is actually shared or restricted. And again, this is part of the issue that this is patient data, so it's confidential data. Unless data sharing protocols and consents been approved, then you're not allowed to see the data accordingly. Note though, the actual program stores anonymized encrypted data anyway, so that any patient identifying factors are pre-screened and removed. This is rough headers of the data fields that's contained within that particular data set. Not surprisingly, having data on its own is not very useful unless you can analyze it. And in this particular case, there's a toolbox. The analytic toolbox contains tools which can allow you to do some analysis. And again, these are things that we've already defined and worked through before in the past. The workflow I said earlier is effectively telling you what you're going to do. There are custom workflows, predefined workflows, and adaptive workflows. In other words, we have ones that we define ourselves, but if you've got your own workflow analytics you want to do, you can load it on the system and run it yourself accordingly. In the final bit, then there is an analysis results, which have analyzed the data, will then be accessible so you can see the output files of what the analysis have been. And again, you can then look at each one of these accordingly by either visualizing it, sharing it, or if you think it's no good, deleting it accordingly. The last tab here is visualization. This allows you to visualize the results of your analysis in a format that is much easier to understand and comprehend. What I want to do next is just demonstrate an analysis in the work of the workflows itself for a data set. So we go to the workflow itself. We want to go to a predefined workflow. And what I want to choose for today's webinar is to look at blindness specifically. So in predefined workflow, we can look at predictions, and you look at blindness prediction itself. Okay. This is the prediction items we want to do. This is where we want to run up, and these are output files and risk of blindness, complications, diabetes. Okay. When you want to run it, you need to generate the analysis. It'll then tell you we need to find an input file. So you need to select a file. Here we're looking specific towards blindness. Select it. You need output file. Because this is a live webinar and we'll demonstrate this tool's working, then we choose a file name that's live today. So in this case, We've chosen that as the title, and if people want me to change it, I'm more than happy to change. Feel free to let me know. Update it. This tells me that the script is now running. Okay. Go down to the main screen, run the program. It now tells me that the queue for the analysis of my predictive modeling for blindness is running, and it started accordingly. Click OK. On top here, the program will then run and will tell me when it's running. So it tells me that the predictive modeling for blindness has now started, it's running. When it's completed, it will then stop, disappear, and you can see the results in our analysis results itself. That tells you that even though we've got large amounts of data, the analysis took less than a couple of minutes. Now we look for the results itself. And its first web test, there it is there. We can then visualize the results and go in the visualization page. So if you look at predictive modeling, you see that that modeling itself, because it is a text file, has given you a statistical analysis of the associations for blindness. I'm not a statistician, I don't claim to be one, but what it allows you to do is see which values are significantly associated, not applicable, and which ones are more applicable and what the actual values are. Okay. This I find difficult to understand, but again, for people who are statistically minded, this is very exciting for them. Fine. I'm a jobbing clinician. I do prefer things that are much more graphically demonstrated. And what I want to do is demonstrate to you then what the other graphs that we've got available in our visualization panel. Let's look at some data sets that we've done beforehand to look at blindness. And then see some of the things that you can see that can tell you whether or not there's an issue. One of the things we want to do is look at heat maps, which then, sorry about that, which then allows you to be able to see the associations of various parameters within the entire data set, not just those ones that we did in the analysis. So if you look at it that way around, you will see there a heat map showing the various associations within the data sets that are associated with death, renal failure, or blindness. These are the defined data fields that have been used accordingly. You note these are the common ones that people are already aware of associated with diabetic connection. There's a significant omission that one's aware of, which is medication. And again, these are things can be done when you update the data sets and update accordingly. That is fine for researchers to be able to hypothesis generate why lipids here is a poor association with blindness, whereas triglycerides are much stronger. So that's just one example of one issue that can arise from just using heat maps. That on its own isn't sufficient because trial coordinators and team designers need to develop trials with patient populations. What does that mean? Let's look at visualization a bit further and add a new visualization itself. Here we want to look at population pyramid. What's that look like? Well, population pyramid can define your population sets and incidence of illnesses. In this case, we've been talking about is blindness. This is the graph you can plot with blindness itself. This is the incidence of people who've got blindness or not blindness. And then these are the patients who are not affected. So this is based on HbA1c levels only. So these are people who've got high HbA1 levels, but only these ones are blinded. So if we're looking for intervention for HbA1c levels and want to target a population for test subjects, you can see that you aim probably for this group here in a 70 to 80 range, where almost half the population have got high HbA1c levels, are blind, and the other half are not affected. So that's just one parameter you can use for defining what population to target your selection group for a trial for intervention for a particular disease process. Let's go a bit further to a predictive modeling of how that actually looks. Again, if you go back in your visualization itself, and we talked about analysis today with blindness. So let's look and see where we are. This is the blindness prediction modeling that we've already done based on the analysis. You'll see here some selection values, HbA1c, BMI, lipids, and blood pressure, and looking specifically at the complication of blindness. These are just some of the preliminary analytics we've built in, but others will be added in as the site develops. Things like medication, for instance, will be there. You'll then draw a predictive modeling survival curve. You can see, therefore, that from disease onset, from diagnosis, which is timestamped here, to the chance of going blind, which is this curve here, changes. So in other words, anybody that can survive 60 years after the disease diagnosis is liable to be effectively blind. So that if you were looking for intervention, you'd be looking at it before the inflection of the drop-off point. So that gives you a chance for the researcher to decide where best to target the patient for intervention per se. It also allows clinicians to interact with the patients itself. What do I mean by that? I mentioned this is a predictive modeling and survival. These factors here are potentially changeable. So in other words, if you modify these things, you can change the survival curve. Let's show that to you. Have very abnormal results. It does analysis, and then you update the graph, it'll plot it, and for those that are more astute, that will be a new graph that's then plotted accordingly. So the slope and changes of that will alter accordingly. We can redefine these, and there are other ones where you can have high and low limits drawn so that you can then see what the effects of that would be. Note these other functionalities: add, share, and remove. This is a platform that's web-based, which means that if you are a researcher working with a team and your colleagues all together, you can edit, share, and remove these things so that your team can share the screen, look at the results as you play around with these various parameters, decide what intervention is required. That's the beauty of this as a web-based product, which will be helpful for both researchers as well as clinicians at the front when they're first seeing the patient. Thank you. That's basically the analysis we've got today to demonstrate, to say why we're so excited by this.
If you have any question at a later stage, you can also email us. You can find our contact details on the website. I would like to close this demonstration session. I would like to thank you for attending. We will be sending you next week the video from this visualization, from this demonstration, and we are going to ask you some questions to get some feedback. Thank you very much for attending. We are looking forward to seeing you also in our next demonstrations, and hopefully at the event, at the conference in May in Rotterdam. Have a nice day. Bye-bye.